Hi, this is Morgan Rowe. I did my concept map over a back surgery. My patient is a female. She's 69 years old, and she had a full code status, and she was allergic to back drum and codeine. So I have some of her information right here. Her vital signs, her temperature was 98.4 degrees Fahrenheit. Her blood pressure was 130 over 51. Her pulse was 62, and her O2 was 97 on room air, and her pain on a scale of 0 to 10 was a 5. She was pre-diabetic, so her blood sugar was 103, and on her head-to-toe assessment, she had no pupil reaction bilaterally because of the narcotics she was on, her pain med from the back surgery, and she had lower back pain from the surgery. She had generalized weakness. She had her lower back incision with stitches. She had a low red blood cell count, low hemoglobin, and low hematocrit levels, and that could have been possibly from her surgery, from having surgery, and she lives with her husband, and that's who helps take care of her. So for my first diagnosis, nursing diagnosis, I have activity intolerance related to pain and surgical procedure, as evidenced by external discomfort, fatigue, and generalized weakness. And the concept that goes with that is tissue integrity. I have patient will transfer to the chair using her walker with standby assistance by the end of shift, and have a pain score of 2 to 3 while ambulating by discharge. For the nursing interventions, nurse will collaborate with physical therapist and occupational therapist, administer pain med before ambulating to decrease pain, and assess pain score before and after ambulating. And for evaluation, I had pain while ambulating was manageable due to pain med being given before walking. 15 minutes of therapy was done by PT and OT. So the next one I'm going to go to is pain for my second concept that I used, and the nursing diagnosis that goes with that is acute pain related to surgical injury agent, as evidenced by facial expression of pain, positioning to ease pain, and self-report of intensity using standardized pain scale. And so I have patient will perform activities of recovery or activities of daily living by discharge, and describe how unrelieved pain will be managed by discharge. For the nursing intervention, nurse will perform a comprehensive assessment of pain, administer ordered pain medication, and assess pain level every hour. And for evaluation, I have administering the pain medication was successful in lowering her pain level, and her pain level should continue to be evaluated. And then for my third concept, I have comfort, and the nursing diagnosis that goes with this is impaired comfort related to insufficient situational control, as evidenced by distressing symptoms, feeling of discomfort, and inability to relax. I have patient will provide evidence for improved comfort compared to baseline by discharge, and evaluate the effectiveness of strategies to maintain and or reach an acceptable comfort level by discharge. For my nursing intervention, I have nurse will ask about patient's current comfort levels, manipulate the environment as necessary to improve comfort, and encourage patient to use relaxation techniques to reduce pain anxiety, depression, and fatigue. And for evaluation, I have having blinds closed, TV on, and pillows at her sides help the patient feel more comfortable and more relaxed. So to connect tissue integrity and comfort, I have the tissue integrity being compromised from the back surgery. Incision makes it difficult for the patient to relax and remain comfortable. And to connect tissue integrity to pain, I have, since the patient is in pain, it makes it hard for her to get her up or turn herself. So she has a risk of compromised tissue integrity by possibly developing pressure ulcers from being in pain. So she is on her back mostly, so she can develop pressure ulcers on her heels or on her back or coccyx or wherever. And to connect pain and comfort, I have, when a patient is in pain, it is difficult for them to get or stay comfortable. And when you are uncomfortable and in pain, it can lead to irritability. So it is our duty as student nurses and nurses to ensure our patient's comfort level is high and that it's definitely a priority. I think that is all for my concept map. Thank you.